together we are greater than stroke. World Stroke Day is celebrated every year on 29th October. The purpose of celebrating this day is to make people aware about the dangers of stroke and to tell about the measures to prevent it and how its danger can be reduced by making necessary changes in lifestyle. When a blood vessel in the brain bursts and starts bleeding or the brain is not properly supplied with blood, a stroke occurs. According to the World Health Organization, WHO, stroke is one of the most common neurological conditions that can leave a patient disabled for a long time. Apart from the patient, this is a very painful situation for the family members too, so its danger can be avoided to a great extent by making some important changes in lifestyle. These days, people are becoming victims of many health-related problems due to their busy lifestyle. Many people from across the country and the world are continuously falling prey to these problems. Stroke is one of these serious problems, which is one of the leading causes of death worldwide. This is a medical emergency which occurs when blood flow to brain stops. Without blood, brain cells start dying. It can cause severe symptoms, permanent disability, and even death. According to American Stroke Association, there are 5 types of strokes. Ischemic stroke, clots. Transient ischemic attack, TIA. Hemorrhagic stroke, bleeds. Cryptogenic stroke. Brain stem stroke. Ischemic stroke, clots occurs when a blood vessel supplying blood to the brain is obstructed. It accounts for 87% of all strokes. Spot a stroke fast, F face, alarm, S speech difficulty, T time to call. If a person shows these symptoms, time to call hospital immediately. Transient ischemic attack, TIA is a warning stroke caused by a temporary clot. Take this warning sign for stroke seriously. Anyone can have a TIA, but the risk increases with age. Stroke rates double every 10 years. After age 55. If you've previously had a stroke, pay careful attention for signs of a TIA because that could signal a second stroke in your future. Common warning signals include sudden onset of weakness, numbness or paralysis on one side of your body, slurred speech or difficulty understanding others, blindness in one or both eyes, dizziness, severe headache with no apparent cause. Hemorrhagic stroke, bleeds occurs when a weakened blood vessel ruptures. The 2 types of weakened blood vessels that usually cause hemorrhagic strokes are aneurysms and arteriovenous malformations, AVMS. The most common cause of hemorrhagic stroke is uncontrolled high blood pressure, hemorrhagic stroke, epileptic seizures, as progressive neurological deficit, headache, etc. Cryptogenic stroke, in most cases, clots that block blood flow to the brain cause a stroke. Sometimes, the cause of a stroke can't be determined. This is called a cryptogenic stroke. Possible hidden cause of stroke: irregular heartbeat, atrial fibrillation. Patients are at a 5 times greater risk for stroke. Heart structure problems, such as patent foramen ovale. Hardening of the arteries, large artery atherosclerosis. Blood clotting disorder, thrombophilia. Brain stem stroke. When stroke occurs in the brain stem, it can affect both sides of the body and may leave a person in a locked-in state. When a locked-in state occurs, the patient is generally unable to speak or move below the neck. Similarly, brainstem strokes can be caused by a clot or a hemorrhage. Rare causes include injury to an artery due to sudden head or neck movements. Some of the causes of stroke. High blood pressure. High blood pressure is the main cause of brain stroke. Atrial fibrillation. Irregular heartbeat increases the risk of blood clots and stroke. Diabetes. High blood sugar levels damage blood vessels, increasing the chances of stroke. Smoking and alcohol. Poor lifestyle and alcohol smoking habits also play an important role in the risk of stroke. Family history. Family history of stroke can increase its risk. Symptoms: headache, dizziness, numbness in hands, vision problems, feel weakness, balancing, trouble while speaking or understanding, paralysis in face or one side of body, etc. Some of the measures to prevent stroke. Have a healthy diet. The first step to prevent stroke is change in lifestyle, in which healthy diet is very important. The diet includes fruits, vegetables and whole grains. Physical activities. Physical activities like jogging, walking or swimming for some time every day keeps the weight under control and the risk of stroke is negligible. Be aware of symptoms. Timely identification of its symptoms is extremely important in the fight against stroke. For this you should know about the word fast, face drooping, arm weakness, speech difficulty, time to call emergency services. By having information about this, you can take necessary steps on time. Regular health checkups. The risks of stroke can also be reduced by getting regular health checkups done. Routine health checkup keeps us informed about things like cholesterol, blood sugar, blood pressure, etc. so that if there is any fluctuation, it can be corrected with the help of necessary medical assistance. Avoid smoking. Smoking is very harmful for health. This not only increases the risk of cancer but also brain stroke, because it reduces the level of oxygen in the body. So the sooner you quit smoking, the better.